Hi, so my name is Phoebe Nyarko. I'm a nurse practitioner practicing here in the United States, and I would like to add in my contribution regarding the topic of colon cancer in the setting of the recent passing of Bernard Nyarko, who was one of our favorite Kumawood actors in Ghana. So I just wanted to share, enlighten you guys regarding colon cancer, and just for us to be much aware of what that all entails, and then also to best educate people around us regarding the topic, just so to protect ourselves from buying into all these like conspiracy theories out there. So colon cancer is a very common and lethal occurring cancer, and it basically begins in like the large intestines in the form of polyps or polyp cells, and then over time they become cancerous. And here in the United States alone, here in the US, about 53,200 people die of colon cancer daily. And according to the World Health Organization, back in 2018, about 13,000 new cases were diagnosed in West Africa alone. So the cause is a little bit uncertain. However, we know that there is a change in the DNA of the cell that could lead to the cancer. And let me just give you an example on that. Basically, in a healthy human being, the healthy cells grow and divide in an orderly way in order to keep the body functioning normally, right? But when a cell's DNA is damaged and becomes cancerous, these cells continue to divide even when new cells are not needed. And as the cells accumulate, that's when they form the tumors that can cause the cancer. So it's pretty intense. So risk factors include old age, being an African American, having a personal history of polyps, having a family history of colon cancer, having diabetes, being obese, smoking, having an inactive lifestyle, actually eating a high fat, low fiber diet can put you at risk for colon cancer. How do these patients tend to present to us at the clinic? They tend to present with unusual bowel habits such as diarrhea or constipation, or feeling as if they are not fully emptying their bowels. They can also have nausea, they can be vomiting, they can have abdominal pain or have a mass, both abdominally or rectally. They also complain of rectal bleeding, fatigue, unexplained weight loss. Anemia is also a huge one that we should also note. On the topic of screening, we screen patients anywhere from 50 years and up, or 45 years if they have a family history of colon cancer, or they are high risk, or they are African Americans. And also we do that by way of colonoscopy, which we can do either every 10 years if you're low risk, and I think every 5 years if you have polyps and you're high risk. We also do Cologuard. The Cologuard test for DNA cells in the large intestines, and it can detect if patient is at risk for colon cancer. That can be done every 3 years. We also do fecal occult blood tests, where we check for the presence of red blood cells in the stools in patients 50 and up, and we do that almost every yearly when you go for your physicals. And we can also do it incidentally. We can find it by doing an abdominal and pelvic CT scan, and it can show if you have any tumors in the large intestine. So we stage colon cancer by doing the TNM method, or just knowing that it's a stage 1 through a stage 4. TNM method involves you knowing that, okay, T stands for the primary tumor, N stands for the lymph nodes involvement, and M stands for metastasis, or it moving to other parts of the body. When it comes to the topic of colon cancer, it can move to the abdominal cavity, it can move to the lungs, it can move to the liver, it can move to just about anywhere once it gets to the lymph nodes. Also, stage 1 to stage 4 is kind of similar. Stage 1 is primary tumor, where it hasn't moved yet, all the way to stage 4. Stage 4 is basically it metastasizing to other parts of the body, or moving or traveling to other parts of the body. And wherever the tumor travels to, the cancer travels to, you're going to find symptoms from that. For example, if it travels to the lungs, eventually you're going to have symptoms suggestive of lung involvement. So why do people lose weight when they have cancer? Okay, so there are a couple things that can happen. First, the body produces what we call cytokines, and these cytokines fight off the cancer, and by doing so, the person loses weight. Secondly, when you're undergoing chemotherapy and radiation, it can actually decrease your appetite. So most of the time, these cancer patients are not eating as much, and that's also going to cause them to lose weight. Other theories suggest that these cancer cells are pretty hungry cells, so they basically compete with the healthy cells for your nutrition. So you could be eating as much as you can, and the cancer cell would steal all the good nutrients from the good cells, and hence can cause you to lose weight. Colon cancer is treated by way of doing chemotherapy, radiation, and surgery. It looks like in Bernard's case, he had surgery done. He ended up with the colostomy. For prevention, we want to do smoking cessation for sure, watching our weight, being physically active, knowing our family history, especially if your family has history of colon cancer. Make sure that you tell your primary care provider so you can get screened early. Also, I'd advise that you comply with the routine screenings. For example, at age 50, please our fathers, make sure you comply with the colonoscopy appointments. If you cannot do the colonoscopy, you have the option of doing the Cologuard testing, which can be done every 3 years, and mostly the insurances cover that. Also, make sure you're eating low fat, high fiber foods that can also help to prevent that. And please, being aware of your family status. I can't stress that enough. I'll end by saying that colon cancer can be easily managed if caught in its early stages. Therefore, it's very important that we comply with the necessary recommendations that I made in this video. Also, I want to beg most of these bloggers that we limit, passing on conspiracy theories, because what, if a patient is having such symptoms, you guys make it harder for them to come to us. There's nothing wrong with having those symptoms. You are not being cursed or anything. It's humanity, and stuff happens. So when you do get symptoms, please report it to your provider as soon as possible. And I'm sure that Bernard would really like the fact that I'm sharing with you guys the cause of his death and what that looks like. And I'm sure that we can make something positive out of this unfortunate event that happened.